Reports emerging from the southern tip of South America have triggered a wave of alarmist headlines, with some outlets declaring the Patagonia region a forbidden zone and unsafe for human life. As a news organisation committed to factual accuracy, we must separate the sensationalist hyperbole from a very real and statistically significant public health development. According to the latest epidemiological bulletins from the Argentine Ministry of Health, the 2025 to 2026 Hantavirus season has seen a sharp and concerning spike in confirmed cases. Nationally, the country has recorded 101 cases since June of last year, a figure that nearly doubles the 57 cases reported during the same period in the previous cycle. This surge has pushed the national case count above the epidemic threshold for much of the analysed period, prompting health officials to implement early detection protocols and heightened surveillance. While the term "unfight for life" is an irresponsible exaggeration for a region of millions, the data indicates that the risk profile for residents and travellers in specific rural and semi-rural environments has changed substantially. +1 The primary concern for health authorities is the Andes virus, a specific strain of hantavirus endemic to the Andean Patagonian forests. Unlike most other hantaviruses found globally, the Andes strain is the only one documented to be capable of person-to-person transmission. Though such instances remain rare, it typically require prolonged, close physical contact. The virus is primarily carried by the long-tailed pygmy rice rat, scientifically known as Oligorhizames longicordatus. These rodents do not show signs of illness themselves, but shed the virus in their saliva, urine, and droppings. Human infection typically occurs through the inhalation of aerosolized particles, essentially microscopic droplets of dried rodent waste that become airborne when a contaminated space is disturbed. The resulting illness, hantavirus pulmonary syndrome or HPS, is a severe respiratory disease with a historically high case fatality rate. In the current 2025-2026 season, the mortality rate in Argentina has climbed to approximately 30%, a significant increase from the 15% average seen over the last 5 years. This uptick in both virulence and frequency is what has led to the current state of high alert across the provinces of Chubut, Rio Negro, and even as far north as Buenos Aires, where cases are unexpectedly surfacing. The international dimension of this public health crisis centered on the MV Hondius, a Dutch-flagged luxury cruise ship that departed from the port of Ushuaia, often called the city at the end of the world. On May 2026, the World Health Organization was notified of a cluster of severe acute respiratory illnesses among the ship's 147 passengers and crew as it traveled across the South Atlantic. The outbreak resulted in 3 deaths, including a German national who succumbed to the virus after the ship was diverted to the Canary Islands. Laboratory testing confirmed the presence of the Andes virus, sparking a multi-national contact tracing effort led by the CDC and the European Centre for Disease Prevention and Control. Investigations are currently focused on a bird-watching excursion in Ushuaia that several of the infected passengers attended before boarding. Investigators are sifting through fragmentary evidence to determine if the exposure occurred during this trek through forested hillsides or if a rare instance of shipboard secondary transmission took place. The CDC has since deployed a specialised team to meet the vessel in Spain to assess exposure risks for the 86 passengers and 61 crew members, many of whom are now considered high-risk contacts. +4 simultaneously, a geopolitical rift has emerged between the Argentine government and the World Health Organization. Argentine officials have publicly criticised the WHO for what they describe as politicizing the outbreak, particularly the focus on the cruise ship incident, which they argue obscures the broader ecological context. Domestically, the geographic footprint of the virus is shifting. While Patagonia was traditionally the epicenter, recent data shows that 83% of Argentina's hantavirus cases are now occurring in the country's far north and the populous Buenos Aires province. This shift suggests that the virus is expanding into new territories, likely driven by habitat destruction and the expansion of rural residential areas. In the mountain resort of Bariloche, a key entry point for Patagonian tourism, the first human case of 2026 was recorded just days ago, involving a patient who required immediate hospitalization. These developments have strained local health systems, as clinicians must now differentiate early hantavirus symptoms, such as fever, muscle aches in the thighs and back, and gastrointestinal distress from more common seasonal illnesses like influenza or COVID-19. The window for effective intervention is narrow. Once the cardiopulmonary phase begins, characterized by a rapid accumulation of fluid in the lungs, a patient's condition can deteriorate into life-threatening shock within a matter of hours. Understanding the environmental drivers of this surge is critical for effective prevention. Scientists point to a perfect storm of climate variability as the primary catalyst for the current rodent population explosion. A period of historic drought in 2023 and 2024, followed by unexpectedly intense rainfall in late 2025, has triggered an abundance of seeds and vegetation cover, providing a massive food source for the long-tailed mouse. This ecological imbalance, coupled with the loss of natural predators, has brought humans and infected rodents into more frequent contact. For those living in or visiting endemic areas, public health guidance is strict and non-negotiable. The most vital rule is the wet clean protocol. Because the virus is inhaled via dust, health agencies warn against dry sweeping or vacuuming any space where rodents may have been present, such as cabins, sheds, or barns. Instead, surfaces must be thoroughly soaked with a disinfectant solution, ideally 1 part bleach to 9 parts water, and allowed to sit for at least 15 minutes before being wiped down with a damp cloth. This process deactivates the virus and prevents it from becoming airborne. Despite decades of research, there are significant limits to our current medical capabilities regarding hantavirus. There is currently no specific antiviral treatment or vaccine available for HPS. Survival depends almost entirely on early detection and high-quality intensive care, including mechanical ventilation. The long incubation period, which ranges from 1 to 8 weeks, makes tracing the exact moment of exposure a logistical nightmare for surveillance teams. In rural communities like Cerro Centinela, health officials have resorted to isolating close contacts of confirmed cases to monitor for symptoms, a strategy that highlights the ongoing concern regarding person-to-person spread of the Andes strain. As the 2026 season continues, travelers are advised to avoid abandoned buildings, store food in rodent-proof containers, and sleep only in areas with active rodent control measures. While the forbidden zone rhetoric is a product of internet sensationalism, the reality of the Andes virus remains a sober reminder of the volatile interface between human expansion and the natural world. We will continue to monitor official statements from the CDC and the Argentine Ministry of Health as they work to contain this spike. For more factual deep dives into global health reporting, consider subscribing to this channel. The core of the current international investigation centres on a significant cluster of infections linked to the MV Hondius, a Dutch-flagged luxury expedition vessel. On May 2, 2026, the World Health Organization received formal notification of a severe respiratory outbreak among the ship's 147 passengers and crew members, following its departure from the port of Ushuaia. This incident has transformed a regional health concern into a multi-jurisdictional crisis involving the CDC, the European Centre for Disease Prevention and Control, and South American maritime authorities. To date, 3 fatalities have been confirmed in connection with this specific vessel, including a German national who died shortly after the ship was diverted to the Canary Islands for emergency medical intervention. Laboratory analysis conducted in specialized biosafety Level 4 facilities has confirmed the presence of the Andes virus strain, a development that has triggered an aggressive contact tracing operation spanning several continents. The CDC has since dispatched a specialized viral hemorrhagic fever team to Spain to meet the vessel and assess the health status of the remaining 86 passengers and 61 crew, many of whom are now undergoing rigorous daily monitoring for early symptoms of hantavirus pulmonary syndrome. The investigation into the source of the shipboard infection has focused heavily on a terrestrial excursion conducted in the forested outski Arts of Ushuaia. Preliminary reports suggest that a group of passengers participated in a bird-watching trek through dense undergrowth, a known habitat for the long-tailed pygmy rice rat. Surveillance teams are working to determine if the virus was introduced to the ship via a single point of exposure in the field, or if the rare phenomenon of secondary person-to-person transmission occurred within the confined environment of the vessel. While person-to-person spread is a unique and documented characteristic of the Andes strain, health officials emphasize that it generally requires the type of close, prolonged contact found in household or clinical settings. The possibility of shipboard transmission has placed the global maritime industry on high alert, with new protocols being drafted for shore excursions in endemic regions on the mainland. The Argentine Ministry of Health is grappling with a shifting epidemiological landscape that contradicts traditional patterns. While the most sensational reports label Patagonia as the primary forbidden zone, the latest government data reveals a more complex reality. Approximately 83% of the 101 confirmed cases in the 2025-2026 cycle have been recorded in the northern provinces and the high-density metropolitan area of Buenos Aires. This represents a significant geographical expansion of the virus's active footprint. In the Patagonian tourism hub of Bariloche, the local healthcare infrastructure has been placed under extreme stress following the admission of the first human case of the 2026 calendar year. Clinicians report that the diagnostic process is increasingly fraught, as the early prodromal phase of Hantavirus, marked by high fever, severe myalgia in the large muscle groups, and gastrointestinal distress closely mimics more common viral pathogens. However, the progression to the cardiopulmonary stage is uniquely rapid. Hospital records show that patients can transition from stable breathing to full respiratory failure and cardiogenic shock in less than 12 hours, requiring immediate access to mechanical ventilation and specialized hemodynamic support. Compounding the public health challenge is a growing diplomatic friction between Argentine authorities and the World Health Organization. Official statements from the Argentine Ministry of Health have pushed back against the WHO's framing of the outbreak, with government spokespeople accusing international bodies of politicizing a localized ecological event. Argentina maintains that the focus on the cruise ship incident has overshadowed their domestic efforts to manage the surge and has created an unwarranted stigma against the Patagonian tourism sector. Despite these tensions, the data remains sobering. The national case count has remained above the epidemic threshold for several consecutive months, and the recorded mortality rate of 30% indicates a level of virulence that far exceeds the historical 5-year average of 15%. National laboratories are now working double shifts to process a backlog of samples from rural clinics, as the window for effective intervention depends entirely on a high index of suspicion from frontline medical staff and the rapid deployment of intensive care resources. Addressing the surge in hantavirus cases requires a rigorous understanding of the environmental and ecological drivers that have transformed the risk profile of the 2025-2026 season. Scientists tracking the outbreak in the southern hemisphere point perfect storm of climatic shifts that triggered a massive rodent population explosion. A period of prolonged historic drought in 2023 and 2024 was followed by an exceptionally wet spring in 2025, leading to an overabundance of seeds and vegetation, a phenomenon known as masting. This boom in food resources supported a rapid increase in the population of the long-tailed pygmy rice rat, the primary reservoir for the Andes virus. As the rodent population density increases, these animals are pushed into closer proximity with human settlements, barns, and tourist cabins. Understanding this cycle is the first step in effective surveillance. Health agencies now use satellite imagery to monitor vegetation density as a predictive tool for future outbreaks, allowing for the pre-positioning of medical supplies and the implementation of early public warning systems before cases begin to appear in local clinics for the public. The most critical takeaways involve breaking the chain of transmission through specific evidence-based hygiene protocols. Because the virus is typically contracted through the inhalation of aerosolized rodent waste, the method of cleaning potentially infested spaces is a matter of life and death. Public health directives emphasize that individuals should never dry sweep or vacuum areas where rodents have been present, as this action kicks up dust particles containing the virus. Instead, the wet-clean method is the global standard. This involves wearing a high-efficiency particulate mask, such as an N95, and thoroughly saturating all surfaces and droppings with a disinfectant solution composed of 1 part bleach to 9 parts water. This solution must remain in contact with the surface for at least 15 minutes to fully deactivate the virus. Only after this soaking period should the waste be removed with a damp cloth or mop and disposed of in a sealed bag. Furthermore, ventilation is a key pillar of prevention. Any building or room that has been closed for an extended period must be aired out for at least 30 minutes before entry to allow any lingering aerosolized particles to dissipate. The limits of current medical science regarding hantavirus remain a SOB, our reality that defines the surveillance strategy. There is currently no approved vaccine or specific antiviral treatment for hantavirus pulmonary syndrome. Because the virus causes the immune system to trigger a cytokine storm, leading to rapid pulmonary edema, survival is almost entirely dependent on the speed of clinical intervention. In Argentina, health officials have implemented a strict 45-day monitoring period for anyone identified as a close contact of an infected individual, a protocol unique to the Andes strain due to its potential for person-to-person spread. In rural communities such as Cerro Centinela and parts of Chubut, this sometimes necessitates supervised isolation, a strategy that balances individual liberty with the ethical imperative to protect the broader community from an outbreak. This surveillance is complicated by the virus's long incubation period, which can keep a patient asymptomatic for up to 8 weeks, meaning the threat can linger long after the initial exposure has occurred. As we look at the headlines declaring certain regions unfit for life, it is essential to ground our response in facts rather than panic. While the 30% mortality rate and the geographic expansion of the virus are statistically significant and demand a high level of vigilance, the risk can be managed through informed behaviour and robust public health infrastructure. The ethical reporting of such events requires acknowledging the uncertainty that still surrounds hantavirus, particularly why certain individuals develop more severe symptoms than others, and the precise mechanics of its transmission. We must treat the current surge not as a cause for regional abandonment, but as a call for renewed investment in ecological research and rural healthcare readiness. As officials continue to track the movement of the Andes virus across both the northern and southern provinces, the primary defense remains a combination of